Welcome to this explainer. Today we're unpacking a really fascinating topic, how a newly established public sector medical college is stepping up as a vital solution to some deep regional healthcare gaps. You see, for decades, the vast central and southern regions of Balochistan faced severe healthcare shortages. We're talking about patients and aspiring medical students having to travel massive, exhausting distances just to get care or an education. Well, enter Jhalawan Medical College in Khuzdar. We are diving right into how this institution operates as a true sentinel of public health in some incredibly challenging geographical terrain.
And that brings us right to the institution's official motto: integrity and honor before anything. Now, this isn't just a catchy phrase slapped on a brochure, it actually anchors the entire ethos of the college. It sets a really dramatic, noble, and serious tone for the medical professionals training there. Think about it, when you're building a healthcare system totally from the ground up in a remote region, integrity and honor are literally the foundational tools you need before you even pick up a scalpel.
Okay, let's dive into this. Here is our roadmap for the tour today. First, a healthcare sentinel emerges. Second, inside the massive campus. Third, academics, seats, and fees. Fourth, administration and government hierarchy. And finally, transforming Khuzdar's medical landscape.
Section 1. A healthcare sentinel emerges, decentralizing medical education in Balochistan.
So, like I mentioned, central and southern Balochistan historically relied really heavily on the capital, Quetta, for tertiary care. But a massive shift happened, and it happened fast. In 2017, the Balochistan cabinet gave the initial approval to establish new medical colleges. By 2018, just a year later, which is wild for infrastructure projects, the formal foundation was laid, and the first intake of 50 students began their studies. Then, from 2021 to 2023, the institution underwent this massive campus expansion on the RCD road. It is incredibly impressive to trace this journey from a mere government proposal to a fully functional hub in just a few short years.
Now, with that rapid campus expansion came a growing student body. We're looking at about 400 students today, and they are unified by a very distinct visual identity. Their strict uniform standards really reflect this cohesion. The college colors? Sky blue and maroon. Their emblem is actually super detailed. It beautifully combines the caduceus, that traditional medical symbol, with a book of knowledge, all set right against the backdrop of the Khuzdar Mountains. Students wear a white lab coat with this insignia. Female students wear a white shalwar kameez paired with a maroon or sky blue dupatta, while the guys wear a formal white shirt and trousers or a white shalwar kameez. It's a highly cohesive, professional look.
Section 2. Inside the massive campus. Building on the RCD highway.
Now, what's really interesting about this slide is the sheer jaw-dropping scale of the provincial investment. 500 acres. Strategically situated right on the N25 transit route between Karachi and Quetta, this isn't just a single building squeezed into a city block. Not at all. It's a sprawling complex designed to house an entire medical ecosystem, preparing the whole region for decades of future growth.
So, how do they use those 500 acres? Well, the academic structure is brilliantly separated into two main wings. First up, you have the Basic Sciences wing. This handles all the foundational laboratory learning, stuff like anatomy, physiology, and biochemistry. And it's fully equipped with high-tech computer labs and a dedicated dissection hall. On the flip side, you've got the Clinical Sciences wing. This focuses on active clinical rotations, general medicine, surgery, pediatrics, which mostly happen at the affiliated DHQ Teaching Hospital. It's a setup that perfectly bridges that gap between textbook theory and actual hands-on patient care.
Of course, to support this kind of rigorous medical study, your infrastructure has to be rock solid, especially in a geographical terrain where a lot of these students are traveling really far from home. So the campus currently features 4 operational hostels, evenly split between male and female students. There's a library boasting over 5,000 titles, alongside comprehensive digital access, plus your modern lecture theaters and tutorial rooms. But the absolute coolest part? A dedicated 500-bed hospital project right on campus is currently being expedited for completion. That is going to be a massive game changer.
Moving on to Section 3, academics, seats, and fees. Making medicine accessible.
So how exactly is Jhalawan Medical College making medicine accessible to the people who need it the absolute most? Well, the core academic offering here is their 5-year MBBS program. And let me tell you, the 50 to 100 available seats are highly coveted. When we break down how those seats are distributed, the big takeaway is how prioritized the local candidates are. A huge chunk goes to divisional merit, specifically for the Kalat division, and district merit for Khuzdar, Awaran, and Las Bella. Sure, there are provincial and special quotas too, but by prioritizing local students, the college is ensuring that the people who study there are way more likely to actually stay and practice in their home communities. And this brilliantly illustrates the financial reality of that access. Because Jhalawan Medical College is a government-funded institution, the open merit annual tuition fee sits around 22,500 Pakistani rupees. Compare that to the self-finance or UEAP seats, which run at 500,000 rupees. It visually underscores just how heavily the government subsidizes public education. The goal is simple but powerful. Ensure that brilliant minds from rural areas simply aren't priced out of becoming doctors.
Section 4. Administration and Government Hierarchy. The Engine Room.
So, behind the scenes, this sprawling provincial machine is governed by a board of governors and runs on a very clean, structured grading system for its civil servants. You can see the hierarchy right here. The principal sits at the very top at basic pay scale 20 or 21, professors are at BPS 20, and then it moves down through associate and assistant professors all the way to lecturers and senior registrars at BPS 17. The administrative and support staff fill in from BPS 1 up to 16. It's a very clear hierarchy, and it ensures the academic and clinical leadership stays tightly organized.
But hey, creating a hierarchy on paper is one thing, actually staffing it is another. To attract top-tier medical talent away from the comfort of big cities and out into more remote areas, the government wisely offers some extra incentives. Faculty members here receive additional health professional allowances, as well as hard area allowances that are specific to Khuzdar. Honestly, it's a completely necessary and practical step if you want to build a world-class faculty in a developing region.
All right, Section 5, Transforming Khuzdar's Medical Landscape, the Tangible Legacy.
So the crucial point is moving from the blueprints and the administrative scales to the real-world human impact. And to be clear, the early days of the college were not without their struggles. In fact, students frequently protested over things like laboratory equipment issues and permanent faculty shortages. But they pushed through it. A monumental turning point was securing PM&DC accreditation. That's the official regulatory recognition from the Pakistan Medical and Dental Council. Championed by early leaders like Dr. Abdul Samad Gichki, securing this accreditation turned those early growing pains into a permanent institutional victory, completely validating the college on a national level.
And with that accreditation came some absolutely incredible socioeconomic and health benefits. I mean, the tangible impact is staggering. Because the college is present at the DHQ Hospital, they've been able to introduce specialized surgeries like neurosurgery and advanced orthopedics that were literally never available in the region before. Khuzdar has transformed from just a transit town into an actual hub for medical tourism in central Balochistan. Plus, it significantly elevated the ratio of female medical graduates in the Jhalawan region, and they've even formed active alliances with the WHO for public health surveillance.
But get this, the impact isn't just local. For a relatively new, remote regional college, they're already establishing a global footprint. Faculty and students are actively publishing research in PubMed and Scopus Index journals. They are focusing on really critical local health issues, like the prevalence of hepatitis B and C among healthcare workers and depression and tuberculosis patients. They're taking regional data, studying it, and contributing those findings to the global medical community. That is huge.
Which leaves us with this final thought. When you look at the rapid rise and the profound impact of Jhalawan Medical College, we really have to ask, as institutions like this expand, how will decentralized medical hubs reshape the future of public health? Because building medical infrastructure from the ground up in remote regions doesn't just treat the patients of today, it fundamentally alters the socioeconomic future of entire generations. Thank you so much for joining me on this explainer, and I really hope this dive into the source material has left you curious to learn more about the incredible power of decentralized healthcare.